Shoulder arthroplasty is much less common than knee or hip arthroplasty. Arthroplasty means replacement. Replacements of the shoulder are generally done for one of two reasons: arthritis, or wearing down of the articular surface between the ball and the socket, or arthritis in the setting of also having a chronic rotator cuff tear. The difference between the two is mostly important for me, the surgeon, in making sure that the right appliance or prosthesis is picked for your specific situation. Arthroplasty is performed on an inpatient basis in those patients who have failed conservative measures such as therapy, stretching exercises, injections, and the like. Once we get to the point where you require arthroplasty, we talk about the risks and benefits of the procedure. The benefits are clearly improvements in your arc of motion, because the rocky road that is in your shoulder, the arthritis, is removed as part of the procedure, and a smooth articulation of the joint is provided. This not only improves generally upon your mobility of the shoulder, but also your function and your pain relief. There are a number of different types of arthroplasty. Hemiarthroplasty requires just replacing the ball. Total shoulder arthroplasty provides replacing the ball and the socket. And reverse shoulder arthroplasty again replaces the ball and the socket, but in a different way, where we place now the socket on the ball and the ball on the socket. All of these procedures are performed in a hospital setting and generally require at least a 2-night hospital stay, both for IV antibiotics as well as for a drain that's generally placed at the deepest extent of the wound, which is removed on post-operative day 2. Risks of the surgery, like any arthroplasty procedure, involve continued pain, need for further surgery, infection, instability, and even death. The procedure is performed under a general anesthetic, unlike a knee or a hip that can sometimes be performed under a spinal. What one would expect on the day of surgery is meeting me in the preoperative area after having arrived at the hospital 1.5 to 2 hours prior to your scheduled time. I would mark the extremity or shoulder that we're replacing and answer any last-minute questions. You would then meet the anesthesiologist and talk to them about not only the general anesthetic, but the possibility of receiving an interscalene block. An interscalene block is a block that the anesthesiologist performs with local anesthetic that makes the entire arm numb. It's much like when you wake up on your arm after falling asleep on it and it feels dead. This is temporary, and it generally helps the anesthesiologist limit the amount of narcotic pain medication that they provide to you while you're asleep, which then helps you have less post-operative pain, particularly immediately following surgery, as well as less post-operative nausea. Once we take you to the operating room, we generally have the nursing staff, once you're asleep, place a Foley catheter in your bladder. This is performed to make sure that you don't get distension of your bladder during the surgery, and also once you get to the floor on the first night of surgery, you don't have to worry about getting up to use the restroom. I remove that Foley catheter on post-operative day 1. The surgery itself involves an incision along the front aspect of the shoulder between the deltoid muscle and the pec. You'll have an incision in this region, as well as a small drain that exits the arm down here. The surgery itself involves developing this plane, getting down to the joint, performing the surgery where the ball and/or socket is replaced, closing up the wound, and applying a dressing. The surgery itself takes between 2 and 3 hours. Once the surgery is complete, we place you in a sling with an ice pack on the shoulder with the drain hooked up to a small reservoir. Again, the drain is removed 2 days following surgery if it's placed. You're then sent to the recovery room for approximately 1 hour. I obtain x-rays of your operative side, either in the operative suite while you're still asleep or in the recovery room. Once you're moved to the orthopedic floor, we start you on oral and IV pain medications if needed. The day after surgery, we have the therapist work with you so that you understand what types of gentle exercises you'll be performing at home. If you wind up going to a short-term rehab facility when you leave the hospital, we also instruct the therapist at that rehab hospital as to what we expect with regards to motion. Simply put, generally after a total shoulder or hemi-arthroplasty procedure, you generally are going to be in the sling just a few days. Thereafter, you'll wear it out in public to make sure that a friend or relative doesn't come up and hit you on the shoulder. In those people that have a reverse shoulder arthroplasty, you spend the entire first 2 weeks except when bathing in the sling at all times. General rules for a traditional arthroplasty, the hemiarthroplasty or the total shoulder arthroplasty, is generally passive range of motion exercises only for the first 8 weeks, followed by strengthening exercises thereafter. For a reverse shoulder replacement, after you remove the sling 2 weeks post-operatively, we start you on gentle range of motion and transition you into early active range of motion where you're lifting your arm with your own power much sooner. Either surgery generally has excellent results with regards to pain relief and function. Should you have further questions about shoulder arthroplasty or what to expect both prior to, the day of, or after surgery, please feel free to contact us at any time. Thank you.